Imagine walking into a town, right? And there's only one grocery store.
Okay.
But you go inside, and the shelves are just half empty. So you think, hey, I should open a competing store. But then you're told that by law, you actually have to go ask that first store for permission to compete with them.
I mean, that sounds like a literal cartel.
Right. But in Delaware's healthcare system, it's just the law.
It's wild. And it really challenges everything we, assume about how supply and demand are supposed to work in our communities. Like, we tend to think that when patient wait times stretch into months, it's just a shortage of doctors.
Yeah, exactly. Like, we just need more people wearing white coats. That is the instinct.
Right.
But what if there is this entirely hidden layer of, like, invisible red tape actively keeping healthcare out of your community? And that is the mission of our deep dive today.
Yeah, it's a fascinating one.
We are unpacking this comprehensive analysis from the Caesar Rodney Institute, or CRI. And they are a free market think tank focused on evidence-based policy.
Right.
And the sources we have today, they really zero in on Delaware's recent Rural Health Transformation Program grant and this highly controversial healthcare regulation called the Certificate of Public Review.
Yeah, and just to fully grasp the perspective of these sources, we should probably establish the analytical lens here.
For sure.
Because the analysis we're looking at, it comes from Dr. Stacy Beck. She's a senior fellow at CRI.
Okay.
So we are not just talking about, surface-level political commentary. She is an economist. She spent decades studying how market forces, regulations, and financial incentives actually collide in the real world.
Right. She has the receipts.
Exactly. Extensive publications in heavy-hitting peer-reviewed journals to back it all up.
Okay, let's unpack this. Because while we are exploring CRI's free market viewpoint today, our goal is to objectively report their findings, right?
Absolutely.
We just want to lay out the evidence they've compiled piece by piece. We aren't endorsing any specific viewpoint. We just want to put the ideas out there so you can evaluate the mechanics of these policies for yourself.
And honestly, the narrative actually kicks off with what looks like genuinely good news for Delaware.
Oh, totally. The state successfully applied for and won this massive influx of federal cash. It was under the One Big Beautiful Bill Act.
Right. Specifically, they secured the Rural Health Transformation Program grant, or the RHTP.
Right.
And the overarching mandate of that federal funding is to aggressively improve healthcare access and outcomes in rural areas that have been, chronically underserved.
And their primary pitch to get this money sounds incredibly ambitious. Like, Delaware essentially told the federal government, hey, we're going to fix the physician pipeline by building a brand new medical school.
Yeah, all new medical school and drastically expanding residency programs.
Which, on the surface, I mean, if you live in a rural area and you can't get a doctor, a new medical school sounds like the ultimate victory.
It does. But reading through the sources, the timeline problem just jumps right off the page.
It really does.
Because that timeline is the central tension highlighted in Dr. Beck's analysis. Building a medical school is a monumental project. You don't just put up a building.
Right.
You have to secure accreditation, construct the facilities, hire specialized faculty, recruit the students.
And then teach them.
Exactly. They have to do 4 years of intensive education and then another 3 to 7 years of residency, depending on the specialty.
So we're talking about a decade, at minimum, before a single fully licensed practicing physician actually opens up a clinic in a rural town.
At least a decade.
Meanwhile, you have patients suffering from a lack of access right now. Like, a medical school in 2036 doesn't help someone who needs a specialist consultation, like this Thursday.
Yeah, and the analysis points out that the federal government is acutely aware of this lag time.
Right.
That is exactly why securing this grant money came with a major catch.
Ah, the catch.
Right. While the medical school is this long-term expensive goal, Delaware had to commit to a much faster secondary policy change.
And CRI emphasizes that this secondary change costs taxpayers absolutely $0 to implement, but it's projected to improve healthcare access almost immediately.
Exactly.
And that zero-cost silver bullet is Delaware's binding commitment to eliminate, or at least substantially reform, their Certificate of Public Review program, or CPR.
Yeah. And to understand why dismantling this specific policy was basically a non-negotiable condition for the federal cash, we have to move from the state's proposed solution to the actual root of the problem.
Right. We need to define what a CPR actually does to a local market.
Because it's pretty counterintuitive.
Honestly, I had to look up how this actually functions because at first glance, Certificate of Public Review, I mean, that sounds like a standard consumer protection law.
It sounds totally harmless.
Yeah, it sounds like health inspectors making sure a hospital kitchen is clean or something. But it is actually a massive economic barrier. In other states, I think these are known as certificate of need or key-on laws.
That's right. And the mechanism is just so rigid. Under Delaware's CPR program, a medical provider, and this could be a massive hospital system or just a small specialist clinic, just major medical equipment just because they have the money to do so.
Wait, really?
Yeah. They must first legally prove to the state government that there's a statistical need in the population for that additional healthcare capacity.
That is just wild. They literally have to beg the state for a permission slip before they can even break ground or order a new MRI machine.
Exactly.
Just to help you visualize how crazy this is from an economic standpoint, think about it like this. It's like the burger joint analogy. Say you want to open a new burger place in your town.
Oh, yeah.
You have the financing, you have a great location, you know people want your burgers. But before you can open, you have to mathematically prove to the local government and to the owners of the existing burger joints down the street that the town was actively running out of burgers.
That analogy perfectly captures how anti-competitive this whole process is.
It's like asking your competitors for permission to compete.
Right. But what's fascinating here is looking at why these laws were created in the first place. Because the original logic, going back decades, it wasn't malicious.
Okay, so what was the point of it then?
Well, it was based on a very specific fear about how healthcare pricing works. The premise back then was that excess healthcare capacity actually drives medical prices up, not down.
Wait. Which violates basic supply and demand. Right. Like, usually more supply means lower prices.
Exactly. But healthcare isn't a traditional market because of third-party payers,
Right.
Insurance companies.
Ah, right.
So the old logic assumed that if a hospital buys a $10 million imaging machine and they only have enough patients to use it twice a week, they still have to pay off that huge debt.
Oh, I see where this is going.
Right. So the fear was they would artificially inflate prices on everything else, every aspirin, every overnight stay, just to cover the cost of the underutilized machine.
Okay.
So the state stepped in to control the supply, thinking it would basically act as a ceiling on costs.
But the sources are bringing the receipts to show that shielding these hospitals from competition doesn't actually keep prices down at all, like not even a little bit.
No, the data is pretty damning.
Yeah. Matthew D. Mitchell, a health policy economist, published this major review of the empirical literature in 2025, and he looked at decades of data across multiple states.
And what did he find?
The weight of the evidence shows these certificate of need laws do the exact opposite of their intended purpose.
Right. The data reveals a very clear pattern of unintended consequences. By artificially choking off the supply of healthcare facilities, these laws consistently increase overall healthcare spending.
Which is crazy.
And furthermore, they are strongly correlated with reduced quality of care and decreased access to medical services.
Well, yeah, because if a patient has literally nowhere else to go within a 50-mile radius, the monopoly hospital has zero financial incentive to upgrade their facilities or lower their prices or provide better customer service.
They don't have to compete for your business. And the negative impact of this artificial scarcity falls disproportionately on underserved rural populations, which is ironic because those are the very populations the federal grant is trying to help.
And this isn't just an isolated think tank theory either. The sources highlight this joint statement issued by the Federal Trade Commission and the Antitrust Division of the U.S. Department of Justice.
Oh, wow. So the heavyweight federal antitrust agencies are actually weighing in on local state health boards.
Yes. And they took a definitive stance. They concluded that these laws create direct structural barriers to entry.
Right.
They limit consumer choice, they stifle medical innovation, and they essentially hand a taxpayer-funded shield to incumbent providers.
Allowing those already in power to just thwart or delay any new competitors from entering their market.
So if the economic theory is completely backwards and federal antitrust agencies are openly warning against it, how does a state actually justify enforcing this on a day-to-day basis?
Yeah, that brings us to the operational reality of the application process itself. And the sources reveal a bureaucratic quagmire that would terrify any small business owner.
Let's hear the details.
Well, according to Chapter 93 of the state statute, the requirements placed on a new applicant are staggering. Let's say you're a group of specialists wanting to open a new clinic.
Okay, I've got my funding.
Right, but you cannot just submit a building plan. You are forced to compile and submit exhaustive demographic data, heavily researched projected utilization rates, and highly detailed financial modeling for your business.
And crucially, you have to detail the anticipated financial impact your new clinic will have on the existing providers in the area.
Your competitors.
Yes. You essentially have to take highly detailed proprietary business data and make it completely public.
It's unbelievable.
You have to expose your entire competitive advantage to the incumbent hospitals just to ask the state for permission to compete with them.
And then you wait. The delays are massive. The sources point out that out of 30 recent applications, only 6 were decided in under 90 days.
Wow, and time is money.
Time is a critical factor in any business expansion. In healthcare, where supply costs fluctuate and specialized staff need to be hired, a delayed certificate can severely inflate the final cost of the project,
Right.
sometimes making it financially unviable by the time approval is finally granted.
Now, looking at the data provided in the sources, I do want to push back on this narrative just a bit.
Okay, play devil's advocate.
Because I want to look at this narrative of an impenetrable fortress. The text explicitly states that between 2014 and 2020, there were 28 applications for a CPR in Delaware.
Right?
And out of those 28, only 2 were outright denied.
Yeah.
That is a 93% approval rate. If almost everyone who manages to apply gets a yes, is this really the massive economy-crushing barrier that CRI claims it is?
I mean, that is the exact counter-argument often used to defend the program.
It sounds compelling.
It does, but it relies on a fundamental misunderstanding of how economic barriers function in the real world. You are only looking at the visible data. You're looking at the survivors of the process.
Okay, fair point.
Dr. Beck's analysis introduces the economic concept of the chilling effect. The true devastating cost of the CPR program isn't found in the 2 denials.
Where is it?
It is found in the deterred applications. The clinics and imaging centers that leave no statistical footprint because they simply never existed in the first place.
The businesses that looked at the massive rule book, did the math, and just walked away.
Exactly. The sources quote directly what CRI has heard from medical providers across the region. They are explicitly stating, "We don't want to come to Delaware because of the CPR law. It isn't worth the investment to risk approval."
Man, that's rough.
Imagine a rural doctor with $500,000 in funding to open a desperately needed imaging center. They have to decide whether to spend $100,000 on specialized lawyers to fight a massive hospital cartel in a public hearing that might drag on for a year.
Or just take their funding and open their clinic 30 miles away in Pennsylvania where the barrier doesn't even exist.
Exactly. That invisible chilling effect dictates the entire shape of the market without ever showing up in a denial statistic.
Which naturally leads us to ask, who are the people actually sitting in the room holding the stamp of approval and making these decisions?
Yeah, that's a crucial question. The CPR review process is administered by an entity called the Health Resources Board.
And the members of this board are appointed by the governor, right?
They are.
And according to the analysis, this board is heavily populated by industry insiders, like people currently working within the very healthcare systems being regulated.
Yeah, and the structural makeup of the board has drawn intense scrutiny because of that.
I bet.
The sources point to a highly critical March 2021 report from the Joint Legislative Oversight and Sunset Committee.
Okay, what did they find?
When this legislative committee reviewed the day-to-day operations of the CPR program, they discovered that records of votes cast by board members on these massive public health infrastructure projects were either incomplete or entirely missing.
Wait, missing voting records? On decisions that dictate whether a town gets an MRI machine or a surgery center?
Yep.
That is a staggering lack of transparency.
It really is. And if we connect this to the bigger picture, when you combine the lack of transparency with a board full of industry insiders, Dr. Beck's analysis frames this as a textbook example of regulatory capture.
Right, regulatory capture. That's that well-documented economic phenomenon where a regulatory agency originally created to protect the public interest eventually becomes dominated by the very industry it is supposed to be regulating.
Exactly. The watchdog slowly turns into the guard dog for the monopolies.
Wow, that's a great way to put it.
And the mechanism enabling this is baked right into the law itself. Delaware's CPR program is legally required to give undue weight to the effect a new facility will have on current capacity.
Oh, wow. So that statutory language effectively gives existing providers a backdoor veto over any new competitors entering their territory. Now, I know the Sunset Committee tried to step in and fix this back in 2021. The sources mentioned they came up with some recommendations to clean up the process.
They did. They issued recommendations, such as transitioning the Health Resources Board into a purely advisory role.
Okay.
They also suggested creating a centralized statewide database to track utilization levels more accurately and shrinking the bloated 21-member board down to a more manageable 5 to 7 members.
But CRI points out that these recommendations are just administrative housekeeping.
Yeah, they're basically rearranging the deck chairs on a sinking ship.
Right, because changing the size of the board doesn't change the fact that the underlying law itself still artificially restricts competition. It still demands this Soviet-style proof of need before a business can even open.
Exactly. The bureaucratic adjustments fail to address the core economic dysfunction.
But here's where it gets really interesting.
Yeah, the landscape is shifting dramatically.
Because of the federal grant we discussed earlier, the state of Delaware is no longer just debating this internally. They have made a binding, written promise to the federal government to dismantle this exact system.
Right there on page 12 of their official Rural Health Transformation Program grant application, Delaware explicitly stated they are committing to eliminating or significantly loosening these Certificate of Public Review laws in order to reduce regulatory barriers.
And this wasn't just some mid-level bureaucrat making a promise, you know. The state made sure to include a letter of support from the entire General Assembly, signaling united legislative backing for this regulatory reform.
And they locked themselves into a highly specific, self-imposed timeline to assure the federal government they were serious.
What's the timeline?
They mapped out a multi-step process, drafting the actual repeal legislation by the fall of 2026,
Okay.
officially securing a legislative sponsor by early 2027, and most critically, bringing the reform to a final vote by the summer of 2027.
Wow, they really put themselves on a ticking clock.
They did.
But let's ground this in reality for a second. Let's say Delaware follows through, they ignore the lobbying from the incumbent hospitals, and they fully repeal the law by 2027.
Okay.
What is the tangible evidence that this will actually help a patient living in a rural area who needs care?
Well, the sources provide a really compelling preview of what a post-CPR landscape looks like. They point to a 2025 study published in the Southern Economic Journal.
Oh, nice.
This research specifically analyzed the impact of Certificate of Need laws on ambulatory surgery centers.
Let's translate ambulatory surgery centers for a second.
Sure.
We aren't talking about building massive billion-dollar regional hospitals here. We are talking about a local, specialized surgeon wanting to open a small, independent clinic to do routine procedures.
Right, like knee scopes, cataract surgeries, or minor outpatient repairs.
Exactly. And doing it without having to ask permission from the massive hospital conglomerate down the road.
And the findings of that study were crystal clear. Repealing these laws directly and significantly increases local access to medical services.
Because by removing the regulatory barrier, you fundamentally change the career calculus for those specialists.
Yes, surgeons are significantly more likely to continue practicing in rural or underserved communities when they have the freedom to open their own independent clinics.
Makes total sense.
You naturally attract and retain medical talent, which expands access to care in the exact areas the federal RHTP grant is targeting. And you do it all without spending a dime of taxpayer money on a new facility.
Which brings us to the ultimate solution CRI is advocating for in these sources. They aren't interested in just loosening the rules or shrinking the board. Their stance is full repeal.
Complete repeal.
They point to House Bill 318, which was sponsored by Representative Brian Shoup. Now, while that specific bill stalled in committee, CRI views it as the necessary legislative blueprint moving forward.
Because full repeal is really the most direct way to signal to the rest of the country that Delaware is finally open for healthcare business.
And Delaware wouldn't be venturing into unknown territory here, right?
Not at all. The sources reference an interactive state map maintained by the Mercatus Center, which tracks this specific issue nationwide.
Oh, I love a good data map.
It clearly illustrates that numerous other states have already recognized the economic damage caused by these laws and successfully eliminated their Certificate of Need programs.
So there is a deeply proven, data-backed roadmap for managing this transition safely and effectively.
Exactly.
So what does this all mean for you, the listener?
Yeah, why should they care?
At its absolute core, this analysis from the Caesar Rodney Institute is about your time, your money, and your health.
Absolutely.
The vital takeaway from these sources is that while the promise of a new medical school might be a wonderful prospect for the next generation, stripping away this specific layer of regulatory red tape is a zero-cost policy lever that could begin alleviating the crisis of wait times and access today.
Yeah, and the real-world application of these abstract economic theories, I mean, it hits you every single time you interact with the healthcare system.
It really does.
Whenever you are told you have to wait 4 months for a simple MRI, or you find yourself driving 2 hours across state lines to see a specialist, you are likely experiencing the direct downstream friction of these invisible regulatory barriers.
Barriers that exist primarily to insulate incumbent businesses from having to compete for your care.
Exactly. And I want to leave you with a final lingering thought to mull over, something that builds on everything we've explored today.
Oh, lay it on us.
The state of Delaware is clearly, fully aware that removing these CPR regulations will, using their own words from the grant, reduce regulatory barriers and increase local access.
Right.
They are so acutely aware of the damage the law causes that they actively use the promise of its destruction as a bragging point to win federal money.
Wow, yeah.
So if a state government mathematically knows a law harms patient access, what does it say about the sheer entrenched political power of incumbent industries that these regulations were fiercely protected and kept on the books for decades in the first place?
That is a phenomenal question to end on. Thank you for joining us on this deep dive. We hope this empowers you to look a little closer at the hidden rules shaping your everyday life. Catch you next time.